Okay, so my name is Janaki Amin. I'm from the Master of Public Health program at Macquarie University. Before we start today, I'd like to acknowledge the traditional owners of the country from wherever you join today. I'm sitting on the land of the Gadigal people of the Eora Nation in central Sydney at the moment, and Macquarie University sits on the land of the Wadawurrung clan of the Darug Nation. And I'd like to recognise their continuing connection to the land and the waters of the culture. And I pay my respects to any elders past, present or emerging that may be joining us today. And just a little bit of housekeeping before we start. This session will be recorded and you'll be receiving a copy of the recording to your email in the next couple of days. To maximise your experience, we've muted all the participants for now, but if you have any questions, please post them into the Q&A function of the toolbar, and all questions will be moderated and responded to live by the online team or by me at the end of the seminar. So I'm going to give you a short presentation on the Masters of Public Health at Macquarie University. And included in that is going to be a little video that we've prepared with some of the people who deliver the course and some students who are in the course as well. And then afterwards, we'll have an open Q&A session and I can answer any questions that you may have. So just to give you some idea of what the Masters of Public Health at Macquarie University is all about, we run an interdisciplinary program. That means that we've build in expertise into the program that is related to public health. Public health is a very broad field of endeavour and it requires very many skill sets to be run properly. It's an interdisciplinary program. The skills that you learn in the Masters of Public Health have been designed in conjunction with public health practitioners, so you get a real lived experience of the skills that you would need to use to work as a public health practitioner. We have a diverse range of assessments that you do for things like writing policy briefs, doing podcasts, creating advocacy videos, and doing deep research, all of which will provide you with skills that make you employment ready when you complete the course. Like I said, it's an interdisciplinary program and we use units of study and we engage academics from across the university. So it's a multi-faculty program. The way the Masters of Public Health works at Macquarie University is it has 3 pathways in which you can progress your degree. The first year is common to everybody who undertakes the Masters of Public Health, and in it you would complete 7 core units and 1 elective unit as part of your first year. In the second year, there are 3 options of how you can complete the degree. You can keep doing coursework, which is the curriculum program. You can enter the professional practice program, which means that you get a long stint. It's a full session stint of internship with a partner in public health, or you can undertake the research program. I'll give you a little bit more detail of each of those components. So the Master of Public Health, the core units, make sure that you get all the foundations that are necessary to you being a public health practitioner. You will learn foundations in public health, which gives you some of the history of public health and the ethics that are involved in good public health practice. Epidemiology and statistics, which is part of the core foundations of all public health degrees. An understanding of the determinants of public health, as well as health promotion, health systems and leadership. You will then also get the opportunity to do elective units, some of which are run from within the faculty, which includes infectious diseases, inclusive health, and you get to go more in depth into health promotion through program planning and evaluation. We also have a specific unit in global nutrition and food security. And then we also have electives that are available across the faculty in global health, leadership and environmental health. If you do the professional practice pathway, you get to do 3 units or 30 credit points worth of placement with a workplace. So that equates to about 10 weeks of full-time work in a public health practice field. We've got diverse placements at the moment. There are 17 students out on placement in different places, including the Australian Institute for Health Innovation, which is located at Macquarie University. The Macquarie University Hospital, so we're the only university in Sydney that has a hospital on site. At the North Sydney Public Health Network, the Western Sydney Local Health District, Drug and Alcohol Australia, and the Cancer Institute. So there's a wide variety of places that you could work, from places that are national organisations, New South Wales-based health organisations, and non-government organisations. So there's a diversity of placements that you can do. Professional practice pathway allows you to do 1 session of coursework and 1 session of professional practice in your 2nd year. The third option is a research intensive year. So following the completion of all your core work, you can undertake a research program. It is competitive entry into both the professional practice and the research pathway. You need to be performing well in your core units to be eligible into either of those pathway areas. So it's one of the most comprehensive research opportunities to combine with the Master of Public Health in Australia. If you're successful in the completion of that research year, you are eligible to apply for a PhD. It doesn't mean that everyone who does the research pathway wants to do a PhD, but it gives you an opportunity to see what research is like. And again, we have diverse places that you can do your research. So within the department that the course is held in, which is the Health Systems and Populations department, we've also had students who are co-supervised with other departments such as biomedical sciences, the Wake Clinic at Macquarie Hospital, the Red Cross, again, the Australian Institute of Health Innovation, as well as other partners across Sydney who have opportunities to work with us. We're not going to go to Q&A straight away. We're going to play a short video for you now that introduces you to some of our other staff and students as well in the Masters of Public Health program. Welcome everybody to our Masters of Public Health seminar series, and now we've got a session with some of the lecturers from the course and some of the students who've been through the MPH as well. So I'm Janaki Amin, I'm the course director for the Master of Public Health program. I also teach the Epidemiology and Biostatistics unit, the Infectious Diseases unit, and the Capstone unit. So my background is as an epidemiologist in infectious diseases. Most of my research work has been in hepatitis C and in HIV, and I worked in that area of research for almost 15 years. I've also worked in immunisation research and as a surveillance officer in New South Wales. So have worked across public health practice as well as research. And as you heard from what my units of teaching were, they very much are informed by the research that I do and the experiences that I've had. And most recently, that has included developing units that look at how we do contact tracing for COVID and how COVID epidemiology has influenced what we do. And there's very much the practical skills that we learn in both epidemiology and in the infectious diseases unit that we think will really help people skill up in not just working at controlling the current pandemic, but other infectious diseases as well, and other occurrences that might happen in public health that need a direct and immediate response. So that's my experience and what I do in the public health course, and I will hand over to Seema for her to let you know what she does.
Hi everyone, I'm an associate professor in public health. My background is in nutritional epidemiology. I have trained in and worked in public health nutrition for over 20 years. I convene the Determinants of Health course, where we look mainly at the social determinants of health and also environmental determinants of health and how they affect health and disease. My research at the moment is mainly focused on community-based approaches to improving fruit and vegetable intake. So only 1 in 20 people eat enough fruit and veg. And we're looking at approaches such as community gardens, food co-ops and cooking workshops to try and improve this in the community. As we know, they're linked with cardiovascular health, type 2 diabetes, obesity. So it's really important to improve our healthy eating. I also, most of my research in the past has been focused in lower and middle income countries. So approaches to improve malnutrition in children. And I've also done a lot of work in obesity prevention in children as well. So that's basically what I do.
Thanks, Seema. Kylie, would you like to tell us about your public health journey?
Sure. Hi, everyone. So my name is Kylie Gwynne and I teach in the Inclusive Health or Marginalised Populations unit within the Masters of Public Health, which is an elective unit. But my background is actually in health and human services, funding, delivery and policy, mostly in government. But I've spent a bit of time in the not-for-profit sector as well, in New South Wales, Queensland and the Northern Territory. My research interests are in rural and remote health and Indigenous health, and I'm committed to methodologies like knowledge co-production and co-design, and very focused on the ways that we can apply research to solve real-world problems with communities. Yes, that's probably enough from me. Thank you.
Thank you. Rimante.
Hi everyone, I'm Rimante Ronto. I'm a lecturer in public health. So I teach disease prevention and health promotion units and also global nutrition and food security unit. I'm also coordinating professional practice placements. I incorporate my research into teaching, which aligns nicely with the units I teach. My research interests are in diet-related non-communicable disease prevention. And mainly, I try to understand food systems and food environments around us and how this impact on our dietary behaviors. And based on this, I also try to develop interventions to help people to increase their food literacy, including food and nutrition knowledge and skills. So, for example, cooking skills. And also my recent interests are on sustainable diets and sustainable food systems. So I worked as a health promotion officer for a few years before starting my career and doing my PhD on public health nutrition. And this is how I come up in doing more in academic, I chose academic career. So in terms of my teaching, I aim to provide transformative and professionally focused learning experiences to all my students to create job-ready graduates, as all of us do. Thanks.
Thanks, Rimante. And then we've got 2 students with us who are going to let you know about their experiences going through the Masters of Public Health and the pathways they've taken in their learning. Novi, can you let us know what your experiences have been like?
My name is Putunofi Arstalamayani. I'm a second-year master research student in public health, and I have enrolled on MPH degree and started my course in mid-year 2019. And currently, I'm working on diet depression studies for my thesis project. And I have started my specialization in research from the end of July last year. And this pathway allows me to conduct a 10-month project and write a research thesis under supervision And this is a great opportunity for me to taste and experience how to conduct a research, especially because I'm into diet and mental health relationship. So I think it's really like a really meaningful like experience for me to choose this pathway.
Thanks, Novi. Novi, were there any units or particular components of units that interested you, that led you to choose the research pathway?
Yeah, absolutely. Actually, because in my home country, thesis is compulsory.
Right.
So I have done a quantitative research, and some of elective course that have been offered in MPH at Macquarie University, they also like provide qualitative design and also like applied methodology, which is just really useful if you really want to take these specializations. And then, of course, like because one of our core unit, which is like biostatistic, it's really useful for those students who want to conduct like quantitative research.
Thanks. And Seema, who is also on our presentation today, is Novi's supervisor as well. So she's been both of you been very generous with your time today. Seema, was there anything in particular that you noticed coming through the course in Novi's interactions that helped you in engaging her as a research student? So that question's sort of for both of you. What were your interactions before you chose to take each other on as student and supervisor?
Well, basically, I was very lucky to get Novi as a research student because she's quite an exceptional student. But I'd been working with a data set called the Australian Longitudinal Study of Women's Health for many years, and we've done a lot of work in that diet and depression space. And one of the next projects for me was to look at diet and depression in another cohort from this longitudinal study. And so I put it out as a project, and Novi applied for that project. And luckily Novi has a background, maybe she can tell you, in psychology as well, which is really useful for writing up anything on mental health and diet as well. So it was basically just really fortunate that Novi applied, and she's done a systematic review looking at mental health and depression in younger people, as well as doing this analysis of the Australian Longitudinal Study of Women's Health. And she's due to finish soon. So looking forward to seeing the final thesis done as well.
So Novi, I understand that systematic review is actually being published, which is an exceptional outcome during a one-year master's project as well. Was that something that you were looking for in choosing the potential study that you were doing, that it would be something that you could get outputs from?
Yes, definitely, because I'm considering to continue my study in PhD. So I think it's really useful for my career in the future if I have like some publication during my research. So I kind of like fortunate, as Seema said, that because I'm really into like mental health topic, and then my previous research related with physical activity, but I never like been involved in nutrition's approach. So I think it's really a great opportunity for me, and then like, yeah, I feel like really happy when my first publication had been published, and then I think it is like it's not supposed to be like stopped in that way, because we need to disseminate these findings, especially because we focus on young people. So because the other thing now, as Seema mentioned before, that a few people, especially in young people, that consume like healthy foods, especially like engage in healthier lifestyle. So we want to encourage young people to engage with healthy lifestyle, especially with healthy food. So we hope with the result of our study, we can like kind of advocate like people and like those people who are in the public health sector that we need to focus on like nutrition and how to prevent any like psychological outcomes, especially in depressions.
Thanks, Novi. Sounds like you're having a great experience and good luck for the completion of your studies as well. And next I'd like to introduce Rana, who's also one of our students, to let us know about her experiences with the Master of Public Health.
Hi everyone, so my name is Rana. I started the Master of Public Health in session 2 of 2019. I've done a mix of part-time and full-time studies, so that's why I'm still here. I've got 5 units left at the moment, so I'll be done at the end of the year. I took the professional practice pathway, so I went on placement last semester. I did it like in the middle of my degree so that I could kind of have a look at what that would look like and then what electives I should take when I come back to study. So that was useful. I went on placement with the Western Sydney Local Health District, and I was in their health promotion team, tobacco control. And I guess when I came back, I could see the gaps that I needed to fill with the electives that I would take. So I took this session, the evaluation unit for health promotion. Yeah, it's a little bit about me.
So Rana, can you tell us a little bit about what you did when you were on placement at Western Sydney?
Yeah, so my project was for COVID-19 and smoking and looking at the risk factors that might be associated with that. If you're a smoker and if you were to get COVID, would those health outcomes that you get be affected in a more negative way? So we were looking at some of the evidence around that. So reviewing the literature, and then with that being able to look at the statistics and see whether those were applicable or not. And also from there, working in groups, so talking with the tobacco control team, but also the broader team, communications as well. So because of that, we were developing communication tools and using some of the learnings that we have from the Master of Public Health to do that, to develop infographics and little videos that we could share with the community based on the evidence that we found. So that's just a little bit about what I did with them.
So that's great. So it sounds like you were able to use some of your basic learnings from the core units to assist you in your work on practice, and then also come back from practice to look at how you're going to move forward with your Masters of Public Health as well. Mm-hmm. Could you also tell us a little bit about how you found doing the course in the part-time mode? Has that worked for you?
Yeah, so when I first started, I wasn't sure what electives to take. So I took all of the core units in the first semester of session 2 for 2019, and then kind of explored what I would do the following year. And I then took up full-time for all of the core zones and then the professional practice. I think doing part-time gave me the chance to also work while I was studying. So I like that flexibility as well. And I guess I could add something else is that the department administrator, Diana, she advertised a job actually that was at Macquarie, and I applied for that. So it's like a casual job, but I got that position. And I think that's just another way that the MPH staff have been really supportive. And that job is basically doing communications work for the university. And so I guess that's another way that I've been able to develop my communication skills through that.
That's great. Nice to know that you're getting supported across a range of activities through Macquarie University. So some employment opportunities, which is great to hear. And is part of what we'd like to see for our students as well, that they're supported within the department, but also across the faculty and through the university. So that finishes just our panel discussion for the MPH, and we'll be taking some questions after this session as well. So hopefully you've gotten a little bit of a flavour of who's doing the course and who will be teaching you when you join us, and hopefully you will be. So thank you to everybody who joined the panel, and we'll speak again soon. Hi, so it looks like we've got a few questions that have come up as well. So one of the first questions is, what is the typical class size? Our class size varies from around about 40 for most of the core units to slightly smaller for some of the electives. So you get to choice to do the units that appeal to you. Our classes are predominantly run in face-to-face mode, but there are options for some of the units to be in online mode only, or to blend and choose how you want to attend. And that has been really successful to date. As Rana had said in her presentation as well, we do cater for students being part-time, and we alternate the timing that we run the classes, so that if you have to come after work, most of the core units are scheduled so that if you were taking the course over 3 years, that all your electives would be available in the evening at some point. Oh, sorry, all your core units would be available in the evening at some time during your enrolment, so that you can complete your degree. The other question is around opportunities that are available for research. So, like I said, I work in infectious diseases. Rimante works in health promotion, CIMA works in nutrition. In all of those areas, we have research projects available, as well as in a wider connection across the university with people who have research expertise related to public health. In the Australian Institute of Health Informatics, that includes a lot of work that is around big data, around health innovation, around hospital-related research, but all integrated into public health. We also have the opportunity to partner with other research organisations. If there was an area of research you were particularly interested in, we can look at creating pathways for you to do research specific to those areas of interest as well. Some examples of the placements that you can do for professional practice, like Rana said, she was at Western Sydney Local Health District. They've been a really strong supporter of our MPH program, and we've had a number of students who've gone through doing professional practice there, working in health promotion, in tobacco and control, in healthy eating, nutrition and physical health. We've also had a couple of people who have gone on to work for Western Sydney Local Health District in the places that they've had placement. The same has happened at Northern Sydney Public Health Network as well. So it really does create the opportunity. Not all of our students have been offered positions, but we do have really good experience from students who've been on placement, feeling like they've been engaged in a really positive way and developed skills that have really helped them get employment when they've finished their placements as well. So yeah, so there's lots of different places you can do your placements, between the Department of Health, within the faculty, within the hospital, and at local health districts as well. And again, if there was somewhere in particular that you'd like to do your placement that's not on our usual list, we can try and facilitate that as well. And that list of places that we do have, we try and partner students with the organisations that are suitable for them. You go through an interview process with the staff in the Masters of Public Health program so that we can allocate you to an appropriate place. You also get to make a suggestion of where you'd like to go, and we try and align students to where they'd like to be as well for the Masters of Public Health. So going into the professional practice or internship program is not guaranteed. You need to do well in the core units. So that means that you have to perform well. It's around a high credit level in your core units. And you also go through the interview process. You need to have been well engaged with the university and the course. And that's part of the application process for the internship. So it's very much like a live pathway to get you trained for what it would be like for a job interview as well. For studying at part-time for the core units, some of those are run in the evening. So, and we alternate which ones are run in the evening so that they will be all covered by that evening duration at some point. Macquarie Hospital is the only hospital we have partnership with at the moment in terms of the placement offerings. To begin to apply for the Masters of Public Health, if you'd like to come to Macquarie University, is go through the Macquarie University website through Course Finder, and you'll be able to find the details of the course, its duration and what units you'll be placed with. And you can apply online through the Macquarie website. Unfortunately, we don't have any regional placements for the professional practice at the moment, but we do have the opportunity to learn about regional health, especially in our environmental health units. In terms of jobs, so the longer term prospect for jobs in public health is really good. There's very much focus on mental health and aging in public health, and its intersection with the pandemic has really been highlighted. And we would hope to see more jobs being advertised in that space. It's definitely a field that's growing around the world. How that plays out in Australia, we're yet to see, but in terms of aged care, we've definitely seen more money go into that space, as well as public health related to mental health. In terms of the people who join the degree, yes, we do have chiropractors who join the Masters of Public Health, physiotherapists, people who've come straight from undergraduate. So we have quite a few students who've done undergraduate psychology or a Bachelor of Human Science or a general degree in science. We also have quite a lot of nurses, dentists, doctors, who do the Masters of Public Health. So it's quite a diverse range of people, which is also part of the pleasure of being part of that cohort, is that you'll meet people from diverse fields coming in to do the Masters of Public Health. Online study is possible for some of the units. Some of the units will have a requirement to have, some of the units will have a requirement to be on campus for some parts, but we'll let you know when they are. All of our lectures are recorded, so you can access them later online as well. Just check if there's any more questions. I think that is all of them. Unless anyone has any more questions that they'd like to add. I think that's it. Of course, you can always join us at Macquarie through email to ask any more questions. There's also another seminar series that will be available. That is the Postgraduate Exploration Week on the 18th to 20th of May from 5 to 7 p.m. So you can just scan that QR code, and that will register you for the Postgraduate Exploration Week and enable you to join that seminar series. So thank you for joining us tonight, and I hope you have a good evening. Thank you.